Brian Lizza. I'm the Chief Washington Correspondent at Politico. We're very pleased to be joined this morning by Ron Klain, top advisor to Joe Biden's presidential campaign and a former Obama administration Ebola czar, and also the co-host, right, Ron, the co-host of the podcast Epidemic. Oh, did I jump the gun?
You're good.
Okay, sorry. And we're gonna discuss the current federal response to the coronavirus pandemic, some lessons learned from Ron's time in the Obama administration, specifically working on Ebola, although you wore a lot of hats in that administration. And let's maybe get a little bit of your criticism of the Trump administration, what they've done wrong, but also maybe what they've done right, and then talk a little bit about how this issue is going to impact the 2020 campaign. We plan to take audience questions after about 20 minutes. So please tweet your questions to @PoliticoLive on Twitter using the hashtag AskPolitico. That's @PoliticoLive on Twitter and the hashtag AskPolitico. So let's get started. All right, Ron. Let's start with just to how you became one of the few people with an enormous amount of expertise on the sort of intersection of the science, the politics, the communications, and policy response to modern pandemics. There really aren't that many people who have had your czar title. And so give us, and I know you've talked about this quite a bit, but give us the top lessons you learned going into that very unusual job during the Obama administration. Maybe just back up and remind people what was going on at the time.
Yeah, so in October 2014, we'd had the first case of Ebola in the United States, a gentleman named Thomas Eric Duncan in Dallas. There were concerns about the pace of our response in West Africa. So President Obama asked me to come in and become the Ebola response coordinator. Czar was not officially part of the title, and to coordinate the whole of government response that the president had ordered. It was the first time ever we had deployed U.S. troops to fight an epidemic. We sent Operation United Assistance, the 101st Airborne from Fort Campbell to West Africa to help build and support the response there. We had 10,000 civilians supported on the ground as well. And a massive effort here in the United States to be able to identify, isolate, treat, respond to cases of Ebola here in the US. And so President Obama asked me to coordinate that effort in the middle of October. At the time, we were seeing rapid escalation of the epidemic in West Africa, risk of spread throughout the rest of the world, all kinds of projections of nightmare scenarios that were quite possible, spread to Nigeria, other countries. And our goal was to bend the curve there and to get the homeland ready for this and for future threats. And I think we did that, Ryan, with three lessons. I mean, Ebola is very different than COVID. It is much more lethal, but much harder to spread. So this is some ways a harder problem right now, but in other ways a less lethal threat. But I think there are three lessons from that. They're really still applicable. The first was to put someone in charge, a single person in charge. And whether I was a good pick or a bad pick, everyone knew who was on the line for coordinating the response. And I think we've seen a lack of clarity in that with first being Secretary Azar, then Vice President Pence, then Ambassador Birx, now Jared Kushner. I just think clear lines of authority at the White House are important. The second thing was to really use all the tools at our disposal. President Obama, put at my disposal, we had 17 federal agencies working on, as I said, troops overseas, just every tool he had that we needed, that we used. I think President Trump's been a little reluctant to use the full range of his authority. He talks boldly about his authority, but things like the Defense Production Act, which would really make a difference on the supply chain side, he hasn't truly invoked. And then finally, you have to put science and medical expertise first. I was brought in because I knew how to make the government work. I knew how to coordinate agencies. But the strategy of the response was driven by the president's scientific and medical advisors, Dr. Tony Fauci, who was still doing this job back then, Dr. Tom Frieden, who was running the Centers for Disease Control back then, Dr. Nikki Lurie, who was who's the Assistant Secretary for Preparedness and Response at HHS. So those medical advisors drove the response. Again, I think we've seen an uneven record on that in this case. So I think those are the three kind of core lessons that carry forward, along with a lot of very specific points we could get into.
Remind people what the politics of the response were back then. I don't have a clear memory of this myself, but when, and obviously we're in the middle of a campaign and the massive politics in terms of the Trump administration's response. What were the cross currents that you guys were dealing with in that response? What was the sort of left-right debate in terms of, are you doing enough? Are you doing too much? Was it more from the libertarian right saying, "Whoa, this is too much," or was it where were the Hannitys? And tell us a little bit about the partisan climate of that effort.
Well, it's kind of a mixed story. I mean, on the one hand, I will say that we did have good bipartisan cooperation on Capitol Hill for getting our funding to fight Ebola. Congress acted very quickly. 4 weeks gave us 90% of what we asked for. And by and large, we had bipartisan support on the Hill for that. But there were partisan cross currents. And I think the most interesting one was, of course, this person in New York who had been on the national scene and kind of faded away, a guy named Donald J. Trump, who started tweeting quite actively in criticism of President Obama's Ebola response. And I think when people look at the arc of Trump's political trajectory, he had somewhat receded after the birther thing had blown up on his face. And Ebola was his reemergence as a national political figure.
I was not setting you up to mention Trump, but in all honesty, you're not just saying that because Trump's president now. He was someone that you remember at the time as a bit of as a loud voice, a sort of nuisance voice.
Not just that, Ryan, but in fact, studies of social media have shown that the opinions of the American people about Ebola were profoundly impacted by Trump's tweets. I mean, this really was a major factor in how the country reacted to it. And his position on Twitter was, he called President Obama a dope. He said the response was incompetent. He attacked me personally numerous times. But more importantly, his position was that we should not be bringing doctors and nurses who had fought Ebola in West Africa and had contracted the disease back to the US for treatment. As he said repeatedly, if we did that we would spread the disease wildly in the United States, that there'd be massive outbreaks. He said specifically with regard to one evacuation that these people are nice people, but they made their choice. They should be left in West Africa to deal with the consequences. So this was a very harsh, very sharp difference between citizen Trump and President Obama about how to handle Ebola. And of course, President Obama did not take that advice. We did evacuate people back to the US Americans who had contracted the disease. They were all treated safely. There was no spread of the disease as a result of those evacuations. None of the healthcare workers treating them got it, and all but one survived. And so, Donald Trump was wrong. Barack Obama was right. And but that certainly was a contentious exchange between someone who then went on to become, our next president.
Is there, obviously people are picking apart your and Obama's record during that time. With the benefit of hindsight, is there anything that you would have done different to help prepare the next president? Whether it was something you couldn't get through Congress or something you could have done, with just the White House's authority. Is there anything that you would have done different?
Well, look, I think that what's been circulating on the internet recently, people in the social media world saw a speech that President Obama gave in the middle of that response in December of 2014 at the National Institutes for Health that my team helped write, where the president said in December of 2014, hey, we really got to be ready for the next pandemic. It could be 5 years away. It could be 10 years away. And these are the steps we need to take. And we put forward an agenda. When we finished fighting Ebola, I recommended to the president to create a permanent office of pandemic preparedness at the White House. He did that in 2016. I think that was an important step. And then that office wrote a playbook for how to deal with the pandemic, which we left for the Trump administration. During the transition, we talked to them about the pandemic playbook. Outgoing Obama officials ran a war games exercise for the incoming Trump officials on how to deal with this. So look, I think what's fair to say is that on a bipartisan basis, there has not been enough investment historically in pandemic preparedness and response. But I do think that after Ebola in particular, we ramped this up in the Obama administration. We put in place a structure to do it. We put in place a playbook to do it. And I think we would have been much better off this time around if that office had not been disassembled and if that playbook had been followed.
Let's talk about the response, the current response. For you personally, when did you realize, holy, you know what, this is something coming at us that is serious. And look, I think it's the current government officials whose job it is to warn the public. So as a private citizen, I'm certainly don't think that's your job. But just as an outsider with an interest in this, watching it closely, when did you realize? Wait a second, this is a big deal.
So in third week in January, I wrote a piece in the Washington Post with Dr. Nikki Lurie, who I mentioned earlier, who had been a senior official in the Obama administration, laying out the things we should be doing to get ready for this threat that emerged. I then wrote another piece in Atlantic, sorry to mention a competitor here, on January 30th, January 27th, I think. And so I had two pieces in January about this. I testified at the first hearing Congress held on COVID on February 5th and laid out 6 things that I thought we needed to do that were not happening, including the need to confront the Chinese more aggressively. At that point in time, the president had not yet had a one-on-one conversation, as far as we know, with President Xi. They said the first one the White House reported was 3 days later in terms of really confronting the Chinese about this. Even then, the president was still slathering praise on the Chinese for weeks after this. I talked about the need to get emergency funding to the Congress more quickly. They hadn't yet made a request. That same day, they were over in the Senate telling people that they didn't need to make an emergency request at all. So look, I don't claim some special insight on this. I was far from alone in the public health community in January and early February saying that we needed to ramp up for this. We need to be doing more to deal with this. Now I think a lot of experts couldn't grasp just how serious this would be, how widespread it would be. But part of that is because I think a lot of us assumed that this country would do the things it needed to do to get it under control. I mean, the decisions that that were not made in January, in February, have led to the problems we've seen in March and in April. We did not get where we needed to get on testing. We did not get where we needed to get on getting our healthcare system ready. And so if you look at the United States and Korea, both countries had their same first case on the same day. The same day, this epidemic started in both countries the same day. You can count the deaths in Korea in the hundreds. We are counting the deaths in America in the tens of thousands. That shows a real gap in what we did in this country to deal with this problem.
Are you, as someone who knows some of the experts in the administration, I assume, do you have any insight beyond what you've seen reported yourself in terms of who and what portions of the government may have been raising the alarm, and whether it was being taken seriously in other parts of the administration? Do you have any personal insight into those debates, knowing some of the players?
I certainly know the players. I've tried to be respectful of the confidentiality of their dealings. I've offered advice based on my experience, but I haven't really probed. We know what's been reported. What's been reported is that in January, there were officials on the NSC and Secretary Azar at HHS who tried to elevate this issue in the Trump administration. And it appears to have been put on the back burner because the senior people at the White House, particularly Secretary Mnuchin at Treasury and Larry Kudlow, wanted to get that trade deal done with China, that phase 1 trade deal that was so important to the president. They thought that was the linchpin of economic growth and whatever. And so, he signed that trade deal on January 15th. At the very time he should have been confronting the Chinese about what was going on there, he was busy kissing up to the Chinese to get that trade deal done and to get it to stick. And I think when we go back and look at this, we're going to find that our public health got put on a back burner because of these trade considerations. The focus at the White House was on getting in good with the Chinese, and the people in the White House who were raising questions about what was going on in China were kind of shunted aside at that critical time in January, where we really could have had much better insights into what was going on over there, really appreciated the extent and nature of this threat.
How hard is it, Ron, though, just to put all of your anti-Trump views aside for a second, if you can, how hard is it for any president when the death toll is extremely, extremely low in their own country and the number of cases is low? How hard is it for them to hit something like this with everything, knowing, being positive about the economic consequences, but being a little unsure if you don't do it, what the health consequences are going to be? I mean, that seems like the key question when a pandemic is when the scientists are telling you, hey, this is coming at us, this is coming at us. How difficult is it for a policymaker to say, you know what, we've got to shut it all down. We've got to all, isolate when you just don't see the number of cases and deaths, and you give any credence to that argument which Trump has made.
So Ron, what I'd say two things about that. I mean, first, I'd say that what President Obama did with Ebola is a good example of the counter example, which is at the time he really put his foot on the accelerator to have a really robust all of government response. We'd had exactly one case of Ebola in the U.S. And so I think, I think that's an example of someone who took very, very strong measures, a multi-billion-dollar response, extensive work here at home, extensive work overseas to fight the disease at a time when we'd had one fatality in the U.S., I should say. So that's the first thing I'd say. The second thing I'd say is, look, I think there are many phases of this, and I'm not saying that Donald Trump should have ordered, a shutdown of our economy in January. That's not my point at all, Ryan. Yeah. But I think before you got there, should you have really ramped up and accelerated the production and distribution of testing kits in January? Yes, almost every developed country did. We alone did not. If you ask me, well, gee, how hard is this for political leaders to do it? The president of Germany did it. The president of Korea did it. I mean, so this is not some unique thing that no other political leader could do. We should have really put in the orders and taken control of the supply chain if we needed to for the protective gear, so we wouldn't have doctors. We are having doctors and nurses get sick treating people because they don't have the protective gear they need. These are things that could be ordered, right? They could have been ordered in January. They could have been ordered in February. So I separate the question of when the president should have announced or been tougher on these social distancing measures from these 70 squandered days of preparation that could have been used for things that would not have wrecked the economy, that would not have, the worst case scenario, we would have ordered a bunch of tests we didn't need. We would have ordered a bunch of masks we didn't need. We would have ordered a bunch of ventilators we didn't need. That was the worst case scenario. And instead, what happened is all these needs came true. And the worst case scenario we're seeing now is we don't really know where the disease is in the United States. We don't really know who has it. We don't know how many cases we have. We don't know who it's affecting because we're not in a position to test for it.
Let me ask you, what's the most important thing that the administration has done that they've gotten right? So just in general, so far, what's the one thing you would give them credit for?
I think I'd give them credit for two things. First of all, though it has been in fits and starts, by and large, the president has taken advice from Dr. Fauci. And I know there's a lot of Dr. Fauci praise out there, and it's almost kind of become a cultural trope or cliche at this point in time. But I just have to say, as someone who worked with him every single day for 6 months on the Ebola response, he is a national treasure. And I mean, obviously, he served every president since Ronald Reagan. He played a key role in bringing HIV/AIDS, bringing all kinds of treatments for that to the forefront. His work on HIV/AIDS was so significant that he won the Presidential Medal of Freedom, our nation's highest civilian honor, 15 years ago. I mean, this is a person who reached the capstone of his career 15 years ago and has continued to fight epidemics since then. So to the extent that the Trump administration has done something uncommon for them, which is to listen to an expert, which is to tolerate the fact that Tony Fauci doesn't, kind of pull the Trump line all the time, I give them credit for that, okay? Because that's definitely an atypical behavior by this president and this administration, and I think it served us very, very well. I also do think that, I think though he has taken some lumps in this, I think Alex Azar deserves some credit for being the person who tried to raise the alarms on this early, for kind of, trying to persist in the face of a pushback, for, trying to organize a task force before he got big-footed. I mean, I think when this is all said and done, although I was critical of the fact that they did not have this run out of the White House, I still think they needed to have this run out of the White House. I do think Secretary Azar, tried to do a number of solid things here and just kept running into roadblock after roadblock.
I want to talk a little bit about the campaign, but I also want to take some questions from people who are watching. And so I'll try and, we've got a lot of great questions here. We probably won't get to all of them, but I'll try and pop one in about going forward in the campaign. This is a good broad question, Ron. How would you open the economy? What reflect on Trump's plan yesterday And the second part of this question, which I think you touched on already, is how much testing is needed. But what's the open the economy plan?
Yeah, I think, look, I think the open the economy plan, I think involves a couple preconditions and then some conditions.
Yeah.
I think the first precondition is we have to get the number of cases down significantly. I mean, the president's plan yesterday said 14 days of decrease, but it didn't really say from what to what. And I think if, we could be 14 days of decrease in New York and still have hundreds of people dying a day. That's not safe. And so you have to get down to the place where you believe that the number of cases is significantly lower in an area. I think there should be a target on that. That's the first precondition. The second precondition is you have to have testing. And people keep saying this. I know it seems, again, a little bit like repetitive, but the only way to know what you're looking at is to test for it. And so what's really frustrating, I think, to a lot of us on the outside is that this testing effort has just completely stalled out. We're testing no more people this week than we did last week or the week before that or the week before that. And so I think when you listen to this talked about in the media, everyone, I mean, it's just not a Democratic point of view. Scott Gottlieb, who was President Trump's own appointee, has said we should be testing 750,000 people a day. So 3 to 4 million people a week. We're barely testing 1 million a week. Okay, so that's not just a Democratic point of view. I think this is kind of a bipartisan view of healthcare experts that you need to have the testing. Why? Because if you're not testing at least 1% of the population every week, 3 to 4 million people, you don't really know how bad the disease is, how many hidden cases we have, where it's being spread, so on and so forth. And the third thing is the other precondition is you have to have the healthcare system in a particular area that you're going to reopen ready to deal with outbreaks that are going to come. Because when we reopen places, the disease will start to spread again. We'll see spikes in cases. And if the healthcare system is overwhelmed, it's still got too many patients, doesn't have the equipment it needs, it can't really handle that. So those are the preconditions. I think where the president's plan is also weak, Ryan, is on a lack of clarity on what the conditions are for opening. So you just can't have people crammed together. To say just, we should open these things and there should be social distancing doesn't really give people the specific guidance as to how far apart people should be in restaurants, how you would reconfigure these kinds of workplaces, so on and so forth. I think as we start to go back to work, we're not going to be able to work elbow to elbow like you kind of do at a co-working space. We're going to need more space and probably more protective gear. My guess is if you go to a restaurant, you're going to want to make sure that your waiter or your waitress is probably wearing a mask, wearing gloves, maybe even wearing a face shield.
Until when? Until we have a widespread vaccine?
Well, I think until we have a vaccine or until the incidence of the disease is extremely low, right? Until we really have very, very little spread in a particular area. And I think, again, I think that if I were at the White House, I'd be pressing the people at OSHA, at the Labor Department, to develop the kinds of occupational standards we should have for each occupation. What does it take to keep the workers safe and the people they're coming into contact with safe? That's just common sense. That's what we ought to be doing right now.
Let me ask you another reader question on the vaccine, and I'm assuming this is correct from a reader. It says Britain claims they will have a vaccine by September. Their question is, why aren't we more interested in this development? But just in general, you've been following this pretty closely. What's your understanding of the track that the vaccine is on? And then one additional thing is, Donald Trump himself has previously expressed skepticism about vaccines. I mean, let's be honest, he was an anti-vaxxer, or at least expressed some of those sentiments. Do you think he has put his full weight behind the vaccine as the most important thing that we could be doing to get this under control?
Well, look, let's talk about the vaccine itself. I mean, there are encouraging reports from our own labs, as well as from the UK, other countries, about the development of the vaccine. And what I will say is virtually all over the world, scientists are working faster and better than ever to get to a vaccine. And that's encouraging, right? But what I will say is that often these vaccine candidates fail. We think we have a vaccine, but we don't. We put it in testing and it doesn't work. That's what we found with the Ebola vaccine. We had a number of promising candidates. It was probably the third one that was really the successful one. So I think there's a lot of good news, But until we know that it works, we don't have a vaccine. That's step one.
Mhm.
Step two is having a vaccine and making a vaccine are two very, very different things. And I think lay people maybe don't appreciate the challenge of making it. So if this vaccine, if the winning vaccine candidate is in the UK, that one works, making enough doses so that people in the UK can all have it, because they will certainly be the first priority for their own vaccine, and then hundreds of millions of doses so that we can have it in the United States and people in Europe are going to want it. I mean, you're literally going to have to make billions of doses of this vaccine. And it won't surprise people to know that there aren't just empty vaccine plants sitting around waiting for this vaccine to show up. I mean, we use vaccine plants to make vaccines for life-saving vaccines.
What can we be doing now to prepare for that?
So I think there are some kinds of vaccines, it's going to get a little technical, but there's some kinds of vaccines that really require a very small dose. And if one of those is the winner, ramping up productions of millions of doses, that will be easy. Part of this depends on which of these different vaccine technologies is the one that actually works. So you can't really put it in production or have the right production stuff till you know. There's some that will be easy to make, some that will be harder to make. And then, Ryan, we get to the second part of your question, which is, once we make the vaccine, will people take it? And I know when you first hear that, it sounds like a stupid question. Well, of course, we're all scared of this virus. Of course we'll take it. But we've seen recently in our country and throughout Western democracies, a resurgence of this anti-vaccine sentiment. We've seen vaccination rates for things like measles go down a bit. We've seen these kinds of outbreaks of these diseases. And so what we can be sure of is when a new vaccine for COVID shows up, hopefully later this year, maybe early 2021, there'll be all kinds of buzz on social media, conspiracy theories, and
you're already seeing that in some right-wing places in social media. Weird conspiracy theories about Bill Gates. You're starting to see that bubble up.
Right. And I think what people need to know about this is, again, a little bit of a technical point, because COVID is so infectious, the rate of vaccine compliance we will need to establish immunity is extremely high. Probably in the high 80%, maybe even 90%, but it's a high number. And so you think about flu. We've had flu vaccine for a long time, right? Everyone could get the flu, but still only about 55% of people get the flu vaccine. Yeah. So we're going to have to go from there up to the high 80s or maybe even 90. That's going to be a big public persuasion project. And as you say, President Trump, I mean, he has had complicated relationships with vaccines. He obviously says things that are inaccurate about all kinds of things. And so, we're going to need a really thoughtful public health education campaign when this vaccine's available to get people to take it. I mean, I know everyone thinks, well, if I take the vaccine, I'm protected. If my kids take the vaccine, we're protected. Yes and no. Vaccines aren't perfect. And the way vaccines protect us is by us taking the vaccine and everyone else taking the vaccine. And so you block the transmission of the disease. If we can't get that level of compliance, we're not going to really establish national immunity.
All right, Ron, I think we'll go over a little bit, but we have time for one more question from audience members. This is an interesting question, sort of a broad question. What weak points in our society do you think have been revealed by this crisis, and how do we go about addressing them? I don't know if that's a 2-minute question, but
yeah, no, that's fine. Look, I'd say we've seen many weaknesses, I suppose. On the healthcare side, there's no question that this virus, as you mentioned, Ryan, I host a podcast about it with an emergency room physician in New York. And one of our most common sayings on that podcast is the coronavirus affects everyone, but it doesn't affect everyone equally. Mm. And what we're seeing is a tremendously disproportionate effect on people of color, particularly African Americans, Hispanics to a lesser extent, but also them as well. And that is revealing some of the systemic chronic inequities in our healthcare system, in our society, that has led to this, right? People of color, particularly African Americans, don't have the same access to healthcare that others do. They have more healthcare conditions because they're not getting the kind of interventions that others do. And so these racial issues have been exposed as a serious problem. And hopefully this is a wake-up call to do more to address them. Likewise, in general, the lack of access that poor people have to the healthcare system is also coming out. I mean, we're seeing that that there's just not enough access to healthcare treatments for the poor people. That's also a factor. I think on the economic side, I think if I'd asked you a month ago, 2 months ago, tell me who the essential workers are in our society, we would have said, well, healthcare workers and first responders, people like that. But what we're learning is there are a lot of essential workers who we take for granted, the people who are working in grocery stores, the people who are busy creating the electricity that allows us to have this conversation, the people who are, creating the internet that allows us to have this conversation, people who are delivering all the things to our homes for those of us staying in homes. And I hope we come out of this with more of appreciation. Those people, it is an ironic truth, right? That the people who are essential, the people who are working right now, who are at risk, highest risk of getting this disease, are first healthcare workers, of course, and first responders, of course, but are also some of the lowest paid, lowest status workers in our economy, people without benefits, people without protections. And they're the ones who we're really putting at risk to allow people like me and you to stay at home and do our jobs from home. And I hope, we address that in terms of the inequity of that and giving those people the kinds of protections, first, the safeguards they should have, masks, gloves, face shields, whatnot, but also a little more respect, more pay when this is all over for what they've done to help all the rest of us.
Well said. All right, Ron, I think we're going to we'll wrap it up there. Thank you very much, Ron Klain, for joining us. And
thanks for having me, Ryan.
Expertise. Wonderful having you on Politico Live. And just for everyone else who's viewing out there, Politico Live is hosting virtual events throughout the coming weeks with journalists from around Politico's newsroom. Please go to politico.com/virtual briefings to see the latest schedule. And please check out Ron Klain's podcast, Epidemic, which is the top podcast in the medicine category, right, Ron?
Absolutely.
Thank you very much for joining us, Ron.